When you compare Virta patients to a very well-matched control group, those Virta patients are 56% less likely to develop a heart attack, have a stroke, or to die.
If you've ever been diagnosed with type 2 diabetes or some metabolic chronic condition like high blood pressure, obesity, kidney disease, liver disease, or you know someone who has, think about what it means to be labeled with that diagnosis, especially if you're told it's a chronic condition, you're going to be on medications for life. I mean, think about how disempowering that is, and how worrisome and what this means for the rest of your life. But the good news is it doesn't have to be like that. And medicine shouldn't be like that, because we now have emerging evidence that continues to show all of those conditions are reversible, not just manageable, but reversible, with a reduction in medications, with a reduction in costs, both to yourself and to the medical institution. And one group that is leading the way demonstrating this evidence is the group at Virta Health. And today I'm joined by Dr. Adam Wolfberg, who is the Chief Medical Officer at Virta Health. He's trained as an OBGYN, but he's had a career as a Chief Medical Officer of multiple different institutions and now at Virta Health. And what you'll hear is how he was drawn to this concept of metabolic health and of reversing metabolic health. And it was the evidence that brought him there. And now Virta Health has released their annual report on reversing chronic metabolic disease. And so I'm joined by Dr. Wolfberg today to talk about that, to talk about the details and how it should now be standard of care to reverse these conditions and save money in the process. So I hope you enjoy this interview with Dr. Adam Wolfberg. Well, Dr. Adam Wolfberg, thank you for joining me today at Metabolic Mind. It's a pleasure to talk to you.
You as well, Bret. Thanks for having me on your podcast.
Yeah. So as I said in the introduction, you're the Chief Medical Officer at Virta Health. And there was this big report, the annual report on metabolic disease reversal that came out. And I'm really interested to get into the details about that. But first, give us a little bit of your background. What got you interested in metabolic health?
Sure. So I went to medical school with every intention of being a practicing primary care physician and ended up studying OBGYN, did my residency in OBGYN and maternal fetal medicine. And honestly, in the beginning, I was a little bit skeptical of the whole metabolic health and diabetes space. And then I was directed to read Virta's publications. And I was just really impressed, was surprised, honestly, to see the very strong evidence-based foundation for the Virta program. Then I met the team, and the Virta management team is incredible. So the opportunity to work on this public health challenge that impacts more than half of Americans and to work with a great group of individuals was a fantastic opportunity for me.
Yeah, I actually love that you were skeptical at first. I mean, I think that's a healthy dose of skepticism is really important in this, and that you were swayed not by dogma, not by just momentum, but you were swayed by the science, by the research on it. So that's remarkable in the way it probably should be. But now let's talk about this annual report on metabolic disease reversal. And the first thing is I just want to talk about the title. Metabolic disease reversal. So not type 2 diabetes, not hypertension, not obesity, but metabolic disease, and not management, but reversal. So let's take each of those components one by one. So why metabolic disease and not breaking it down to its different components of type 2 diabetes, which is sort of how Virta started. So tell us more about that.
I don't think that listeners of this podcast will be surprised when I say that metabolic disease is a broad condition that has so many component parts. Cardiovascular disease has many of its roots in nutrition and in metabolic disease. The other conditions you mentioned, hypertension, liver disease, kidney disease, to a probably lesser extent, but still important extent, depression, bipolar disease. So many of these conditions can be rooted in metabolic health and metabolic disease, and can be either prevented or improved by changing an individual's metabolism. So I think Virta has its foundation in reversal of type 2 diabetes. That's where we started. And we appropriately branched out into prediabetes and obesity. But what we learned along the way is that it's much broader than that. And so we wanted to focus on metabolic disease reversal, honestly, because the evidence led us there. The evidence demonstrates that that is in fact the case and that we can reverse metabolic disease through our approach to changing what individuals consume.
Yeah, I think that's remarkable. Starting as a type 2 diabetes company, but seeing kidney disease get better, seeing blood pressure get better, seeing liver disease get better, and then being able to connect the dots and say, yeah, it's all related, and even depression symptoms. So I think that's such an important lesson for everybody. But then also reversal, not management, not control, but reversal. So, I remember residency, medical school. I don't think anybody talked about reversal or remission of type 2 diabetes or fatty liver unless it was alcoholic, right? It was you manage it. You manage type 2 diabetes and you hope to delay or lessen the complications that are inevitable. But I think Virta really has sort of put the stake in the ground to say, no, the discussion is now about reversal. So tell me about your sort of how you came to realize that reversal was what we should be shooting for rather than just management.
Again, it was the research and the evidence demonstrating that metabolic disease and type 2 diabetes, obesity, and the complications can be reversed, not just managed. And like you said, that's what we learned in medical school. Increase the dose of insulin as insulin resistance worsens, and see if you can maintain the disease in a state where it doesn't cause all of the complications that plague Americans and plague people around the world. So the opportunity to reverse is just so much more powerful. And one of the parts of Virta I love most is that every single week on our all hands Zoom meeting, we hear from a Virta patient, someone whose life has been changed, and to hear those stories is really inspiring.
So do you think we're at the point now in medicine where any patient who walks into their doctor's office with a diagnosis of type 2 diabetes or hypertension or fatty liver, that the discussion should be, okay, this is how we're going to reverse your condition? Should that be like common first line discussion across all medicine?
When it comes to the core metabolic conditions, absolutely. It ought to be an option, and patients ought to learn that there is an approach to changing what they eat that will very likely improve their metabolic condition. Hypertension, for example, sometimes a change in nutrition will reverse hypertension. Sometimes it won't. I mean, let's be clear. Not all hypertension has a metabolic cause. And so let's take every individual patient as an individual and treat them as is most appropriate for them. But I don't think that most of my colleagues and most of your colleagues think about nutrition as a part of the clinical armamentarium, and they should.
Yeah, certainly not a powerful part of the armamentarium. I mean, if you look at GLP-1s and SGLT2s or even insulin, and then we can add on, lifestyle to kind of help with that. But really that should be kind of flipped on its head. And so lifestyle first as the reversal. And for those who it doesn't work for, then consider the medication. So is that basically the approach at Virta?
It is. And I think you make a good point that lifestyle and nutrition have always been things we ought to think about, but they weren't the beginning. And we like to think of them as the beginning.
Yeah. But now, like you said, not everybody's going to reverse hypertension with nutrition. And there can be many reasons for that. But the same can be true for type 2 diabetes, for obesity, for prediabetes. Not everybody's going to reverse it, even potentially with a ketogenic diet. So how do you approach that at Virta to sort of help those individuals that are trying, that are doing it right, but still not seeing the results they want to see?
Again, we treat every patient individually. And so for our patients with type 2 diabetes, we recommend that they dramatically change what they're consuming, focusing on a very carbohydrate reduced diet. And to the extent that is appropriate and safe, we reduce the dose of the medication they're taking, particularly insulin, in the beginning. And then we watch and see what happens. We want them to be tracking their biomarkers very regularly. We watch those carefully. We then manage their medication doses appropriately. We sort of take on the role of their primary care provider, or in some cases, their endocrinologist. And most patients who change what they eat will be able to eliminate some or all of their diabetes-related medications, but not all. To your point, not all. And so if it's appropriate and safe to continue the medications that patients are on, we do that, because our primary goal is diabetes reversal if possible, management if not.
Yeah, and so what about, semaglutide and tirzepatide, and you can't open up the news or social media without seeing these mentioned every single day. So what role do they have in the treatment paradigm at Virta?
I think those medications are fantastic. I think that they've changed our thinking around what obesity is as a disease and not as a lack of will. And I think that they've changed lots of lives. And I think that when used appropriately, they can be an important tool in the kit. I don't think that they're necessarily more impactful or better than a dramatic change in what one consumes. We've seen very similar results for successful Virta patients in terms of A1C reduction and weight loss, as we do on patients who are on GLP-1s, and as we've seen from published studies. So I don't think that they are the only tool in the kit, but I think that for many patients, those are fantastic drugs. And we prescribe them as indicated. I mean, Virta is not anti-medication. Virta prescribes GLP-1s for our patients with diabetes who need them, and for some of our clients, we prescribe GLP-1s for obesity.
Yeah. And that can lead us to then talking about this annual report, because part of the report was cost savings, much of which was from medications. But before we get into the cost savings, let's talk about sort of the outcomes that you had listed. And, on this report, 4 million pounds lost, which is just sort of hard to wrap your brain around a number that big, and a 3-point average A1C reduction in high-risk patients. But the one that got me was a 56% reduced incidence of heart attack, stroke, or death. So let's focus on that last one, because that's kind of big. So tell us about that, the reduction in the incidence of heart attack, stroke, or death. Where does that come from?
Virta partnered with an organization that has a very large medical claims set. So think of it as the sort of data that come from insurance companies and from payer organizations, all put together into a database. And what it allowed us to do was to create a control population, one for one matched to 7,500 Virta patients. And it allowed us to follow their sort of claims outcomes over time. And I'm really blown away by this research, and incredibly proud that we're going to be publishing it over the next few months in the peer-reviewed literature. But what we showed was that Virta patients, compared to patients just like them, and when I say just like them, I mean patients who have the same diabetes diagnosis or obesity diagnosis, who are taking the same medications, who are the same sort of geographic part of the country. When you compare Virta patients to a very well-matched control group, those Virta patients are 56% less likely to develop a heart attack, have a stroke, or to die. And when we look specifically at death, just death alone, the Virta patients are more than 50% less likely to die than patients who are not on Virta, who look just like them.
Yeah, I mean, that is sort of earth-shattering data. And to be fair, like you said, that you will be publishing in the upcoming months, so not peer-reviewed, published yet, but in preprint form. But gosh, I mean, that's what people feel is missing from ketogenic interventions. Yeah, but you're going to give people heart attacks. You're going to give people cardiovascular disease. People are going to die early because that's what the low quality evidence that's out there now that calls 40% of calories from carbohydrates, low carb, and equates that to keto. So it's been such a sort of a misuse of the data right now to say, keto is dangerous, but here you've got exactly the opposite. So when that's published, I think people need to really take note. But let me ask you, I mean, I think you probably know better than anybody that there is a bias against ketosis, against ketogenic diets in the mainstream media, in medicine. It's felt to be harmful until proven otherwise. Do you think this data is going to cause people to sort of sit up and pay attention and maybe change their mind?
I hope so, Brett. I think that one of the commonly heard criticisms of ketogenic nutrition is that some patients see an increase in their LDL level, and that is presumed to lead to an increased risk of cardiovascular events. And I think that what these data conclusively show is that the risk of cardiovascular events is reduced, and not just a little bit reduced, but reduced a lot. And so I hope that those who have a bias against ketogenic nutrition from the perspective of increasing LDL levels and by extension increasing risk will be reassured that this is incredibly safe.
Yeah, and I think that's a really important point to make. And first, the LDL does not go up in everybody. It's sort of the assumption that it will by those who aren't familiar with it, but it doesn't. But even those who do, what you're showing is the benefits, the metabolic health benefits can far outweigh any small increased risk from a small increase in LDL. So I think that's a crucial point to make.
Yeah, the other thing, Brett, I was going to say is that, to your point, these aren't yet peer reviewed, but the preprints are publicly available. And if you have a mechanism for putting them in your show notes, or we can certainly connect those links, because I know that viewers and listeners of the Metabolic Mind podcast are evidence interested, evidence curious. So we'd love for them to dig in.
Yeah, for sure. We'll share those. Absolutely. But now you also mentioned other diseases as well. So whether it's kidney disease or fatty liver, you have data coming out for these as well?
We do. So same basic study design. Virta patients are a third less likely to develop chronic kidney disease. They're 45% less likely to develop chronic kidney disease stages 3 to 5. Or end-stage renal disease. They're at 62% less likely to develop MASH. And we know that kidney disease and liver disease are fundamentally tied to metabolic health and to nutrition. And, the last one, which is, I think, less important to individuals considering their own health and well-being, but is very important to the health system, is that the Virta program saves money, that those who are making Virta available to their health plan members or their employees are not only just returning their fees and savings, but are saving further on total health expenditure. And that makes Virta, but honestly, it makes carb-reduced nutrition, I think, just a great investment at a time when we're spending so much money on healthcare.
Yeah, and these numbers are remarkable in the report. $1 billion saved in healthcare costs, 9,600 hospitalizations avoided, 75 million units of insulin eliminated, $20 million from insulin alone saved, 118 million from GLP-1 costs avoided. I mean, the numbers are staggering. And I guess part of the pushback could be, well, this isn't just go eat ketogenic nutrition and change your diet. It's also, coaching and monitoring and sort of really sort of hand holding. So one argument would be, yeah, that's too expensive to do, and it's too, it's too costly for everybody to do this. But here you're saying, actually, no. In the end around, it's actually saving money. So, I mean, how do you try and help people realize that yes, it's a more intensive intervention and it involves ketogenic nutrition, but it actually saves you money in the long run? How do you get that message out to payers, providers, employers, and so forth?
Well, I mean, Virta's a business, and so we have whole teams of fantastic individuals who are knocking on health plan doors and knocking on the doors of self-insured employers. We have a very small, loyal group of sort of individual subscribers who pay out of pocket for Virta, but our primary focus is on health plans and self-insured employers. And I hope that these data and that this report makes it easier for plan sponsors to invest in the health and well-being of their employees. I hope that they realize that Virta will save them money, which is super important as healthcare costs spiral out of control. But it's a double benefit, right? When you get to save money and also make your employees healthier and hopefully more productive and more able to get a lot out of life.
Yeah. I guess I'm trying to play devil's advocate to a degree, and others would say, yeah, but it's selection bias. The people who are, jumping in and doing this are the motivated crew. And so it's a very select group. Which I guess you could say, so what? So we're changing the lives of the select group, and that's a huge bonus. But how else would you sort of discuss that topic?
On some level, I would say, so what? I think that selection bias is a good thing. You want to choose to do something and then see the results from it. So I certainly wouldn't want to apologize for the fantastic results that Virta members see. I think that we and you and so many of your colleagues and guests have worked really hard to make carb-reduced nutrition more accessible. Virta has certainly done that. We've seen success across an incredibly diverse group of Americans, those who come from high resource backgrounds, low resource backgrounds, those who shop at Whole Foods and those who live in food deserts. We can, and I think that, with your help, you can make low carb nutrition something that anyone can succeed at doing. And so, let's continue making that possible.
Yeah. So let's talk about that population difference, right? Like anybody who can shop at Whole Foods and buy grass-fed ribeyes and, and wild salmon, and they're probably going to do okay. They're going to have the means to make it happen. It still can be, challenging, and you need motivation and support and whatever, but they're going to have the means to make it happen. But tell me about those who living in the food desert, those who don't have those resources. How do you as a company and your coaches and your doctors and everybody, how do you help those individuals succeed just as well as those with resources to do more?
So to put a sort of fine point on it, it's not that everyone does the same. What we see is the same benefit. So those who live in food deserts, for example, are likely, probably due to the grocery stores in their vicinity, are more likely to start with a higher BMI and with a higher A1C if they have diabetes than those who are living in the vicinity of really fresh grocery stores and produce. So what we're able to do, and that's too bad. Like that's sort of a flaw in the American food environment. That's a shame. What we've been able to do is to help those in food deserts see the same percent improvement as those who live across from Whole Foods. I just want to be clear that we have a lot to do as a society to improve nutrition that's available to everyone, and let's work on that as well. But what we do at Virta is to make the resources available so that anyone can be successful. We have hundreds and thousands of recipes that can find their ingredients anywhere. We have guides to fast food restaurants, how to eat low carb at McDonald's or at Chick-fil-A. Swap out lettuce for a bun, sort of the tips that a truck driver and can use to be successful on Virta, even when they're eating at highway stops. And we have a significant number of truck drivers who are Virta patients. We're very proud of that. So it's kind of experience and practice. We coach in English, we coach in Spanish. Like, we will meet you where you are and help you to be successful. You just have to give us a chance and sort of raise your hand to improve your metabolic health.
Yeah. Yeah, I think that's so important to provide those resources, regardless of where someone lives or what their resources are, and especially the fast food. For truckers, they tend to have such poor health because of the job setup. You're sitting all day long. You're just grabbing and going wherever you can find a meal, and it's not conducive to health. But to have them following with you and getting healthier is great. And having those resources available for them is so important. And it's funny, we talk about Whole Foods like it's a magical place, but even there, I mean, the majority of the store is still, processed high carb type foods. It's just organic, or it's, small batch or whatever, but you still have to focus on the outside of the store and the Whole Foods, no pun intended. I mean, the real Whole Foods and not the store. So it's not like that population doesn't need education as well. So that's where what you provide can be so helpful for everybody.
Yeah, it's such an important point, because I think that we've seen America develop more type 2 diabetes and develop more obesity as the sort of food guidance has continued to evolve. Like, we've helped Americans to get less healthy. And that's why I say, we as a society owe it to our citizens to do better, both in terms of food that's available, but also really in terms of the guidance that they receive around what actually constitutes a healthy diet.
Yeah. Well, so let's change the topic here for a second and talk about sort of the structure of medicine and the structure that has, helped people get less healthy, unfortunately, whether it's the cause or just simply failure to prevent it, whatever's happened, we as a country have gotten less healthy. So what about this model of, don't pay me just to me as a clinician or as a healthcare group, just to talk to somebody about nutrition. Don't pay me just to see them in the office, but pay me based on how they do. Are they reducing their A1C? Are they reducing their blood pressure? Are we having outcome benefits? Then you pay me based on that. So tell us about Virta's experience with that type of payment model.
Well, so sure. So the way Virta gets paid is that we receive a fee every month for eligible patients who are enrolled and active in our program. So if a patient comes in and signs up and gets started and says, actually, this isn't for me, and they disenroll, we stop getting paid. So we are fundamentally value-based care. We get the same fee every month, and then we measure the outcomes and the cost for our clients, and they do the same on their own data. The other way that Virta has focused on being a value-based care provider is by putting all of our fees at risk. We have these things we call performance guarantees. And so depending on the population, we are potentially on the hook for giving all of our fees back if we don't deliver on the outcomes that we promised. The easiest one to explain is type 2 diabetes. So we guarantee a 1% A1C reduction. And if we don't deliver it to that population, we give some of our fees back. We promise weight loss. Same thing. If we don't deliver it, we give back the fees. And then we promise a reduction in medications used by that population. if we can't deliver a reduction in medication use through the appropriate use of nutrition, then we failed, and so we refund our fees. And so that aligns Virta's service model with the business model, where if we don't deliver outcomes and we don't deliver cost savings, then we don't get paid.
Yeah, I love that combination of the outcomes and the savings, because if it was just the 1% A1C, just crank everybody's insulin up and give them more medications, but have you done them any benefit? But by doing it by reducing the medications, that's where the magic is. And that's where people are healthier and there's cost savings. And I mean, that's the life people want to live, not dependent on medications. So yeah, I really like that model. Do you think more institutions should be adopting that kind of model, or that should be the go-to model for healthcare?
I think so. As I'm sure you've watched, Bret, the sort of progress of true value-based care has been very slow. And as a startup guy, I've watched dozens and dozens of companies planning to deliver value fail because they can't. So it's not easy. But I do think if we tied reimbursement to outcome and cost savings, we could really change the way the American medicine is structured. And that would be a win for patients.
Yeah. All right. Well, now to really change the topic, in doing a little research, I found out that prior to going into medicine, you were a print journalist, you were a writer, and that you continue to write. So tell me your perspective on the way the media and journalism sort of handles nutrition and health. I mean, are you optimistic of it? Are you pessimistic? Do you think they're doing a terrible job? Or just give me some of your thoughts as having experienced sort of both sides of the coin there.
Yeah, a million years ago, I was a print reporter in Mobile, Alabama. A fantastic career and a super fun time in my life. And I didn't sign up for it, but they made me a health reporter. And eventually I decided that looked like really an interesting way to contribute. So I went to medical school. But I've got lots of friends in the media, and have watched media coverage of health and wellness now for several decades. And I think that they generally do it right. I think that the media is quick. I think the media is more willing to question the status quo than many other institutions, particularly the ones that are dependent on the status quo in order to continue sort of getting along. So generally, I think media coverage is more curious. I will admit, though, that when you think about journalism and investigative journalism and conversations like you and I are having today, in the context of marketing, it's a losing battle. I mean, you think about the billions of dollars that the pharmaceutical industry pours into getting the message across that you just take an injection and you'll shed the pounds. You think about the marketing dollars poured into the American consumer mind related to ultra processed food, and it's no wonder that there are like movies and shows built around characters like Tony the Tiger. It's like we are sort of spitting in the wind when it comes to messaging American consumers.
Yeah, I think that's a good point, but hopefully something that we can sort of chip away at and start to change from the ground up by individuals sort of demanding more, by knowing metabolic disease is reversible, by knowing you can do it with nutrition, by knowing you can save money doing it. I think that's so important, and that's why I really appreciate that report that was put out, and it's very eye-opening. And I can't wait to hear more once these studies are published in peer-reviewed journals. We want to have you back on and talk more about them. But for now, where can people find you to learn more about you or to learn more about the work at Virta?
So we're at virtahealth.com, and I'm on LinkedIn, and generally terrible at social and getting the word out. So reach out to me, reach out to us, and we'd love to have a conversation with your viewers and listeners. It's a really important service that you're doing to help people who wouldn't have access to this type of information get it. So, thanks for all you're doing, Bret.
All right. Well, thank you. I appreciate it. Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.